Hello, everyone. Welcome back to another episode of the Mama Project podcast. I have a guest for us today. Her name is Carly Hartwig. You may follow her on Instagram. She's at Clean Living with Carly, and she is a fertility awareness educator. And just she always posts really great content on clean living and holistic products and things of that nature. But today we're going to talk specifically about fertility awareness. And I know that this is a topic that she is super passionate about. I know I could talk to her about so many different things, but I chose this because this is her passion project. And I know she posts a lot of content about periods, birth control, and all the things. So we are talking all things fertility awareness today. So Carly, thank you so much for being here.
Thank you for having me. I'm excited to chat.
Yeah, so first tell us a little bit about who you are and what you do.
Sure. I am, I wear a lot of hats. Um, on paper right now, I'm a holistic reproductive health practitioner and a certified fertility awareness educator. I am a former special education educator. I worked in special education for about a decade. So this is like a complete 180. I always say it's like my second kind of like career here. And then I'm also a full-time mom. So that's definitely a lot of pride and joy for me. Although it makes it kind of interesting to try to like run a business while also, caring for a toddler full time. But yeah, that's kind of what I'm doing now. And I've had an Instagram account now for about 5.5 years, Clean Living with Carly, which started out as just a way for me to share kind of my own journey with low tox living and trying to just take the overwhelm out of it for people. I feel like people have been more aware over the last few years of the fact that, like, a lot of our products contain carcinogens and heavy metals and hormone disrupting chemicals. And so people want safer options, but don't know where to start. And it's kind of like analysis paralysis. So I've been on my own journey for so long that I started this Instagram page to kind of share about that. And then it's really snowballed from there. So yeah, my niche has definitely shifted over the years.
I love it. Now, how exactly did you get involved in fertility awareness? Like what were you doing then that led you to the work that you're doing now?
So, like I'm sure a lot of women can relate to, it was really my own journey, which is kind of how everything has started with me. Like my own journey with low tox living started because I wasn't getting the answers I needed from a provider who kept insisting I was fine, even though I felt awful and there were so many symptoms I was dealing with. And it turns out I had this like crazy hormone imbalance. My thyroid was all out of whack. And it took working really with a different provider, getting a second opinion to kind of lead me into this world of really that like you can't unlearn once you learn about like environmental toxins, hormone disrupting chemicals, how those are impacting you. So then, as kind of part of my own holistic health journey, I decided I wanted to get my IUD out. And this was about, how old am I? This was about 7 years ago now. And I remember going to my OB about it. And we were not interested in getting pregnant at the time, but I just wanted to see. I'd been on hormonal birth control for almost like 15 years at that point, and I never once thought about like how it was impacting my mood, my libido, my breast cancer risk. I mean, you name it. Like my OB never talked to me about any of this. I was on the pill for years, and then she convinced me to do an IUD because OBs love IUDs because it's, you insert it once and it's good for 3, 5, maybe even longer years. So she convinced me to get an IUD, and I never connected like, oh, maybe my hormonal birth control is a big part of my like crazy, outrageous mood swings that I was dealing with, or the fact that I had no libido. And so I really wanted to get my IUD out as a sort of experiment. And so when I talked to my OB about it, and I'd done a little bit of research at this point, and I actually found Natural Cycles, which I'm sure a lot of people are familiar with. It's a very popular app with a thermometer, and I will talk about why I thankfully learned that it is not a good option for birth control. But anyways, I'd found that and I was talking to my OB about it, and she was like, okay, like, haha, see you in 6 months when you're pregnant. Like, she just had no concept of anything related to fertility awareness or tracking your menstrual cycle parameters or your fertile markers to avoid pregnancy. And so I got my IUD out, even though she highly recommended against it, to be honest. And I was a completely different person. I mean, like within a month, my mood was stable. I had my libido back again. Like I just felt like a completely different woman. So then I started deep diving into like my basal body temperature, which is what you track with natural cycles. And then I learned that there's this umbrella out there kind of term called fertility awareness method, which if you're looking for like a more religious kind of approach, that would be natural family planning, which originated in the Catholic Church. So I learned about these fertility awareness methods, and there's a lot of them out there. And I learned that you can use them as birth control, like really effective birth control, up to like 99.6% effective. And it was my research into fertility awareness methods that made me realize that natural cycles is not a safe or reliable form of birth control. So then I dove headfirst into actually learning a fertility awareness method. And in doing so, I tapped into like just this crazy feminine power. Like, I don't know how else to explain it. Like, learning exactly where I was at in my cycle, understanding why sometimes in my cycle I felt really, really good after a workout, and other times in my cycle I felt really depleted. Why some days in my cycle I was ravenous, and other days like I could forget to eat lunch, or like just like how all of these like fluctuations with my hormones were affecting everything about me. And so I started learning more and I started using these a fertility awareness method as birth control. And I just found so much freedom and so much power in it. And I was like, okay, I need to be able to teach women this gift of what I consider body literacy. So I went back to school again. So I had a whole lot of degrees to work in a school at that point. And fortunately, I have a very supportive partner. And so I went back and that's where I studied to become a fertility awareness educator and a holistic reproductive health practitioner because I just needed to be able to teach other women how to do this because it changed my life so dramatically. And I just think we're pushed to birth control as our only option if we're not looking to get pregnant. I mean, we're also pushed to birth control for other reasons, like our painful cramps and our acne and things like that. But I just want women to know that there is another legitimate science fact option in fertility awareness methods. So that's really what led me down this path and kind of this second career for me.
So I guess I didn't realize that fertility awareness method is an umbrella term and
Mhm.
there's like a few different methods underneath it. So can you kind of explain just overall what fertility awareness method is, then I guess the different like categories and I guess what you kind of follow or have researched specifically?
Sure. Yeah. So fertility awareness methods, or a lot of times we refer to them as FAM, we refer to that as kind of that umbrella term, like I said, where you're using various biomarkers to determine your fertile and infertile phases of your cycle. So something that I didn't know until my 30s, which is insane, is that we are only fertile for 6 days maximum per cycle. Like, I don't know about you, but like when I went through sex ed, it was like you can get pregnant any day of the month and like you will and blah, blah, blah. And no, that's not the case. That's not the case. So we can get pregnant as a result of unprotected intercourse on 6 days in a cycle because our cervical mucus can keep sperm alive for up to 5 days leading up to ovulation. So we have a biological fertile window of 6 days each cycle. So what we're doing with fertility awareness methods is we're using our biomarkers, whether that's cervical mucus, which is definitely your most important biomarker because it's your real-time sign of fertility. And again, this is something that I didn't know anything about cervical mucus until my 30s. Your basal body temperature, which is your resting metabolic temperature. We take it first thing when we wake up in the morning. And as our cycle kind of progresses, we'll see a shift after ovulation where our basal body temperature actually goes up because our metabolism goes up in the second half of our cycle. Our progesterone rises, which kind of revs up our body temperature. So there's basal body temperature and cervical mucus, which are often used together in a symptothermal approach to FAM. Then there is also your cervix position. So your cervix actually it changes throughout your cycle when you're fertile and infertile. It sits higher or lower, it opens and closes, it feels like softer or harder. So you can palpate your cervix every day. So that's another biomarker. And then there's also like urine metabolite tracking. So like with a clear blue, hormone at home testing device, you can use that as well. So those would be more like symptohormonal approaches. So whether you want to track your mucus or your mucus and your BBT, your basal body temperature, or you want to track those, you want to pee on sticks, a million times a day, which is definitely not my jam, but I know some people are into it. Those are all kind of your options for fertility awareness methods. So if someone came to me and they were like, okay, I want to get off the pill, but I don't want to get pregnant. what do I do? I would tell them, first of all, you need to figure out what you want to track personally. So, what I track personally is my cervical mucus and my basal body temperature. I use them together. It's a symptothermal approach called the Justice method. So, that's what I'm personally trained and certified in. I really like a symptothermal approach. For me, it just has given me a lot of peace of mind to use my body as birth control because I see a shift in my cervical mucus and I see a temperature shift to be able to confirm ovulation and know that I'm out of my fertile window. So those are kind of all of your options. And like I said, there's also religious approaches and then there's secular approaches. So there's really something for everyone, which is kind of cool. And it really depends on what you're interested in tracking, because ultimately, fertility awareness methods are not going to be effective unless you are using them consistently.
Absolutely. So, how is FAM different from the rhythm method or other natural family planning approaches?
So the rhythm method is very antiquated and does not work. So the rhythm method, which for all intents and purposes is natural cycles, it's all of these predictive apps, right? They operate under the assumption that we always ovulate on the same day every month and that we always have a consistent cycle. So most of these apps will start off with like a really generic assumption that you have a 28-day cycle and a day 14 ovulation. Less than 5% of women on any given month have a 28-day cycle with a day 14 ovulation. So we know that ovulation is wildly sensitive to environmental stressors. We do not ovulate on the same day every month. We are not robots. We could ovulate earlier or later based on changes in our sleep, changes in our stress levels, getting sick, traveling, time zone changes, even just changing the clocks, which I know we're going to do this weekend, alcohol consumption, THC consumption, like so many things can impact when we ovulate. And so we will not always have the same exact number of days in our cycle, and we will not always ovulate on the same day. So what the rhythm method does is you look at a calendar and you say, okay, day one of your period is, let's say, November 1st. So you're going to ovulate on November 14th. You're going to have a 28-day cycle. So then you'll get your next period on November 29th. And so what it's doing is trying to tell you like, okay, here's when you're ovulating. So here's when you would abstain, from unprotected intercourse if you're trying to prevent unwanted pregnancy. But again, it doesn't work because we don't always ovulate on the same day and we don't always have the same exact length in our cycle days. So that's why the rhythm method does not work. That's why tracking your cycle in an app or using an app like Natural Cycles with predictive algorithms that does not work. It is not an effective way to prevent unwanted pregnancy. Now, natural family planning is an effective way to do it. It is simply a fertility awareness method that is taught by the Catholic Church. So it is just a very specific type of fertility awareness method that's taught within the Catholic Church, typically during like pre-Cana.
Okay, got it. What about what about birth control? Like we talked about this a little bit before recording, but pretty much right after we have a baby and we go to the 6 week checkup, okay, you ready to get on birth control? And there's
Mhm.
no other conversation. And I feel like a lot of women just take that option because they don't want to get pregnant again.
Mhm.
What are what are the harms in taking birth control? And
Mhm.
why do women just think that that's their only option to prevent pregnancy?
I mean, it starts as soon as like puberty. I mean, how many young girls go to their doctors or like go to their first OB appointment and they get the pill because they have painful cramps or their cycles are irregular. And no one's telling them like, hey, actually, your first handful of cycles, even like your first couple of years of menstruating, things might not be regular, and that's okay. And sometimes you're going to have more painful cramps in the beginning. And instead of saying, here are some things that can help, like, oh, magnesium, like, oh, looking at your diet, trying to reduce the inflammatory foods that you're eating, like, instead of doing these things, talking about omega-3 fatty acids, which again, there's a lot of science between all of those things I just said, supporting like a reduction in menstrual cramps. But instead of doing that, we just write a prescription for the pill. And I always like to make it very clear. I fully support a woman's right to choose what is best for her body. I fully support always having access to hormonal birth control because what's right for me might not be right for you. And also, I don't know a single woman who received informed consent around hormonal birth control, whether that's the pill or the patch or the IUD or the implant, which, by the by, has a black box warning for osteoporosis. A black box warning, which means that is irreversible. And it's like we're just not talked about any of this. Like no one talks to us about it. No one tells us about it. They just put the IUD in, and then I know for me, when I went to my OB talking about some of the symptoms I was dealing with, like the insane mood swings, like to the point that I literally was like, do I have bipolar disorder? Like it was that insane. And she was like, "Oh no, it's not connected. It's not connected." And I was like, "Oh, really?" So my biggest gripe with the hormonal birth control industry at large is the lack of informed consent. We are not told about how it affects our mood. We are not told, especially with young girls. There's a lot of research that shows that when young girls start birth control, especially within the first few years of having a period, it increases their risk of depression throughout their entire life by over 100%. And no one is telling parents this because I promise you, if they were, parents would not be putting their teenagers on the pill for their acne or for their painful cramps. And so we're not talking about these side effects. And the mood piece is a big one. The increased risk in breast cancer is a big one. The lack of libido is huge. And I think so many women are like, what is wrong with me? Like, why do I not want to have sex? And it's like, well, are you on the pill? Do you have an IUD? Like, do you have a patch? Like, these things are very real. And they're all in the inserts too, right? Like, when you get birth control, you have that huge package of like inserts with pages and pages. And like, come on, none of us are
Like
actually
who's
reading it.
reading that?
Right.
Yeah.
And so it's up
Yeah.
to our doctors to tell us, but they're not telling us. And so then it's up to us to do our own research or to feel like we're crazy because it's like, why are all of these things happening? So yeah, and there's also a big piece with nutrient depletion. We know that hormonal birth control depletes really, really important nutrients for our cycle health, for our fertility. And so we're not telling women, hey, let's come off of your hormonal birth control like a solid 6 to 12 months before you're trying to get pregnant, because otherwise you're going to be depleted in nutrients that are critical for getting pregnant, staying pregnant, and having a healthy pregnancy. Or postpartum, to your point. I have heard from so many women that they're like, their nurse or their doctor talks to them about birth control while they're on the operating table or while they're pushing in labor. And it's like, hello, like, why are we talking about this right now? And so a lot of times postpartum, OBs will put you on a progestin only type of birth control. So there's two types of hormonal birth control. There's one that combines synthetic estrogen with synthetic progesterone. And there's another that is only synthetic progesterone or progestin. And so a lot of OBs will tell you, oh, just take a progestin only form. It's not going to impact your milk supply. It's not going to impact your postpartum, mood, anything like that. But that's not true. All forms of hormonal birth control come with risks. And when I think about postpartum and how we just went through the single largest hormone drop of our life, and we are so vulnerable and we are so depleted, and so many women just don't even think about it, right? Because their doctors just write them the script and they go on the pill and they're not realizing that, oh, that's actually increasing their risk of postpartum depression and anxiety or postpartum nutrient depletion. Like, we need all of the information to make informed decisions and we're not getting it. So that is my issue with hormonal birth control.
Yeah, absolutely. So you talked about going on birth control like young girls. So I was put on birth, I mean, I was on birth control for so long
Mhm.
because I was put on it for painful periods when I was younger, like before I was even sexually active.
Mhm.
And, my mom didn't really know, right? It was just, that's what they recommended. My periods were really painful. And so I know, yeah, you said other teens go on it for acne. So in those cases, when birth control is offered, what are other options for these teens who are having either painful periods or acne or other issues once they get their period?
So ultimately, the best thing we can do, because hormonal birth control is very effective at helping with these symptoms, the painful cramps, the acne, things like that, because it blocks our body's production of androgens, right? So it can be effective. However, it's a band-aid. And as soon as you come off of that hormonal birth control, for whatever reason, your symptoms are going to return because you're not actually getting at the root cause of the symptoms. And there is always, always, always a root cause. So, more often than not, it is a hormone imbalance. And for the vast majority of women, that's estrogen dominance. It is by far the most common hormone imbalance out there. So, basically, your body is producing too much estrogen in relation to progesterone. And this is common because a lot of us are not living very healthy lifestyles. We're not doing these foundational things, right? Where we're eating enough protein and fiber, we're eating good vegetables, we're supporting our gut health, we're supporting our liver detoxification. Like these things aren't fancy. They're not going to go viral. Like no one's going to go viral being like, here are the foundational things you need to do to support a healthy cycle. Like we need to eat less inflammatory foods, we need to move our bodies and move our lymph and we're those just aren't the really fancy things, right, that people want to talk about. So typically, when you have too much estrogen in relation to progesterone, and a part of it too is the xenoestrogens, which are a type of endocrine disrupting chemical that we are exposed to in our, food containers and our personal care products and our cleaning products, right? So that impacts our estrogen as well. And then, as I mentioned, most of us are not eating enough fiber, so we're not pooping at least once a day. So our bodies can't excrete excess estrogen because we excrete excess estrogen through our waste. So we have too much estrogen kind of getting recirculated. And that can lead to a lot of really, really common symptoms like painful periods, like heavy periods, like hormonal acne, things like that. So the first thing would want to be checking in on your hormones and taking steps to support more balanced hormones, right? Those foundational things. And then the second leading cause of especially like painful cramps, really intense cramps, is excess prostaglandins, which are caused by excess inflammation. And really, like the root cause of so many issues related to our cycle is inflammation. And so, taking steps to reduce inflammation through your diet and your lifestyle can absolutely help. And then there are also kind of like more holistic things. Like, there is so much research behind the use of magnesium for preventing menstrual cramps, literally as effective as ibuprofen. Right. So magnesium is a supplement I think all women should take every day. But if you deal with bad PMS, painful periods, and things like that, you would want to up your dose of magnesium after ovulation, during the last half of your cycle, leading up to your period. That right there can do so much. And it's like, this is where I wish we were talking to like young girls about this because that's such an easy thing to do. There's also a lot of research around omega-3 fatty acids, which most of us are not getting enough of. We get too many omega-6 fatty acids. We're not eating enough seafood. And so there's a ton of very compelling research around supplementing with omega-3 fatty acids to help reduce that inflammation and keep those prostaglandins down so we don't have the painful periods. There's a lot of research around the use of ginger being just as effective as ibuprofen. So what we're doing is we're telling women like take Motrin or take ibuprofen, take what's that one that's just for periods? You know that Midol, right?
Midol,
Midol.
Midol.
Like take your
Yep.
Midol and like call out of work. Like no, this isn't normal. So what can we
Lay in
do?
bed with your heating pad.
Right? Yes.
Yeah,
What can we do
it's
to kind of
normal.
prevent these things? Yeah. So there is so much that women can do. And I always like to say, like, you should not be popping ibuprofen, but somehow we've just normalized it. Like, I think there's a big confusion between what's common and what's normal because at the end of the day, painful periods are not normal. And we think about things like endometriosis and how it can take up to a decade for a woman to get a diagnosis of endometriosis because her pain is dismissed or she's told, pop your Midol, pop your ibuprofen, and, call it a day. So this is where normalizing this pain is really, really risky.
I had endometriosis, had to have, I don't know if you're in remission or whatnot,
Yeah.
but is that something that can be or that can happen because of hormonal birth control? Because I was on, like I said, I was on birth control for
Yeah.
over a decade, and then I just remember one time I bled for like a month straight and I had polyps. So she went in there and took the polyps, but then found endometriosis because the only
Yeah.
way they can find it is laparoscopically. So is
Right.
that something? Is what causes endometriosis?
It's not going to be caused by the hormonal birth control. However, it is going to be left untreated and left to get worse, right? So there's a lot of theories out there about endometriosis. There are some theories around that estrogen dominance piece, so having too much estrogen in relation to progesterone. But ultimately, what I see happen is women will go to their providers and talk about their painful, heavy periods, and they're given a prescription for the pill, and that's it. And then they're on this pill for a decade, and they really have endo. And then it's just left to worsen and worsen and worsen. And then they come off the pill to maybe get pregnant, right? And then their symptoms come back with a vengeance. And only then maybe their OB will take them seriously and take steps to diagnose it. So this is the problem with using hormonal birth control like a Band-Aid. It's the same thing for PCOS. PCOS on average takes 7 years to get a diagnosis. Irregular periods are one of the core features of PCOS. And if you have irregular cycles and you go to your doctor, 9 times out of 10, they're going to say, let's put you on the pill to regulate your cycle. But it does not regulate your cycle, it shuts it down. The combined pill, the one where you take 3 weeks of pill, 1 week of your placebo sugar pills, that shuts down your cycle because it suppresses ovulation. And so it kills me when adult women, young girls are put on the pill to regulate their cycle when they're actually just completely shutting down their biologically normal function, right? And then we think that that doesn't have like an impact on our health. Like ovulation is so important, so protective of our health. So,
So back to FAM, what are the main misconceptions that women have about this fertility awareness method, and why didn't I learn about this until now? Like, it's just like,
right?
why didn't I learn about this from my healthcare provider, or are they not even
They're not trained in it.
educated
Absolutely.
like
Yeah.
this?
And there's actually this huge push by an OB. I've done some continuing ed under her. She is working really hard to educate ACOG, which is obviously the governing body of OBs in the US, to educate them on fertility awareness methods, which is really cool. So I'm hoping we start to see a shift in the next decade. But there's no training, in their med school about it. And I think a big misconception is that fertility awareness methods are like some woo-woo, kind of approach when really like they have been around for centuries and they are scientifically studied and validated. Like there are there is so much research behind the efficacy of these methods. But where women will get it wrong is, they'll follow someone on Instagram like me or whatever who talks about like hormonal birth control and who tries to educate around, the side effects, and they'll be like, I'm getting off the pill, like this is making me crazy. So then they do and they feel amazing, but then they decide, well, let me just track my cervical mucus or let me just track my basal body temperature, and call it a day when really that is not fertility awareness method. So a true fertility awareness method is standardized. And there are very precise rules for opening and closing your fertile window. And we always, always, always have a longer potential fertile window than we do biological because we need to make sure that our potential fertile window fits our 6 day biological fertile window in it. So FAM is not hard. I think that's another misconception is people are like, oh, it's so much harder than just getting an IUD in. What I like to tell women is it's basically like learning a new language because, again, we're not taught this. No one's talking to us about this. No one's telling us what our cervical mucus means or why sometimes we have it and sometimes we don't. Like, I think about that like in middle school, right? Like, after I got my period, and I just remember, my mom taught me a little bit about my period and celebrated when I got it, but like, she probably didn't know what cervical mucus meant or what it was. So she didn't talk to me about it. And I just remember like being a middle schooler and going to the bathroom and being like, why is there white stuff in my underwear? I had no idea. Nobody told me about it. Nobody talked to me about it in health class, right? So we're not taught this stuff. And so what I like to tell women is it's kind of like learning a new language, right? The language of your body. Our bodies speak so loudly when we are fertile. We just have to learn how to listen. And this is also important if you are trying to get pregnant, right? So these methods can also be used to maximize your chances of conceiving. That's the cool thing about FAM is you learn one method, one time, and you have body literacy for the rest of your reproductive life. Truly. I mean, you can help yourself get pregnant because you'll know exactly when you're fertile and you're not relying on an app to tell you when you're fertile because let me tell you, those are not accurate 99% of the time. And then you can also use this method as birth control. And then you can even track like changes in your cycle as you enter your huge transition of perimenopause, right? So it's like one method, but it really is learning a new language. So you have to give yourself some grace in the beginning. There is a learning curve. But once you learn it, it takes usually for most of my clients 2 cycles, 2 to 3 cycles to really feel confident in it. And then you have this tool to use that takes maybe 1 to 2 minutes a day. That's it. And then you can easily prevent unwanted pregnancy without synthetic hormones. So it is not hard. It definitely does work, but you have to choose an actual fertility awareness method. You can't just wing it, right? You got to follow a standardized method that is scientific, that has very specific rules for opening and closing your fertile window. And then what you do during your fertile window is up to you. So it's up to you and your comfort level. If you are someone who very strongly is trying to avoid pregnancy, a pregnancy would ruin your life, then we would obviously take steps to completely avoid intercourse, vaginal intercourse during your fertile window. If you're someone where you're willing to take a little bit of risk, like you don't necessarily want to get pregnant right now, but it wouldn't be the worst thing in the world, perhaps you're interested in using a barrier method or the withdrawal method during your fertile window. So there's also a lot of flexibility because ultimately using the method comes down to you. You will learn it. You can teach yourself from a book or you can learn from an instructor, but you're the one that's going to be actually implementing that method. So I have been using a fertility awareness method now for over 7 years, and I can tell you that I don't even think about it anymore. I used it to avoid pregnancy for years. I used it to get pregnant with my daughter. Um, and then I used it to get pregnant this time around too. I'm pregnant now, and I knew exactly when I was fertile. And I knew that my cycle was optimal. And like, there's just, again, so much power in learning how to listen to your body and understanding your body.
Yeah, it's absolutely so empowering. Especially like you were talking about, what is this white stuff in my underwear? Like I never knew what that was. I was just like, why am I so dischargy like this time of the month?
Yeah,
Like how like that's our one of our fertile signs. So
yeah,
you talked
our
about that. You
biggest.
talked about the fertile window being 6 days. Is it always like I know you said our cycle length can vary and we'll talk about that in a little bit, but is our fertile window always 6 days? Is it sometimes shorter depending on environment, stress,
Mhm.
whatever time of year? So you said like the fertility signs that women track are mainly cervical mucus and basal body temperature. Talk to us a little bit more about cervical mucus. Like what is it? How do we test it? What do we look for?
I love talking about cervical mucus. It's kind of my shtick. I love it, and I have shared my videos with thousands of strangers on the internet. So, cervical mucus is a type of fluid that is produced by our cervical crypts. So, there are these little crypts that line our cervix. And when we are fertile, this mucus comes down our cervix through our vaginal canal, and we can see it at our vulva. We can observe it as we wipe with toilet paper. So, the reason we have that biological fertile window of 6 days, and I want to stress that it is a maximum of 6 days. So, it could be shorter if you don't produce a lot of cervical mucus or you have a super short cycle and you ovulate earlier, but it will never be longer than 6 days biologically because sperm can live inside our bodies for up to 5 days in the presence of cervical mucus. So, what cervical mucus does is it creates a very nourishing, hospitable environment for sperm. It bathes sperm, it filters out weak sperm, it feeds them, and it allows them to actually swim up through our vaginal canal, through our cervix. So when our body is not producing this type of cervical mucus, sperm die within minutes of ejaculation. Sperm cannot travel when there is no cervical mucus. So when we have this cervical mucus, it actually creates these channels for the sperm to swim up through, right? So these sperm can stay alive for up to 5 days leading up to ovulation. That is why we have a 6 day fertile window. So you could have unprotected intercourse 5 days before ovulation, and that sperm could hang out until the moment that egg is released, and then it could fertilize it. So that's why we have that biological window. So if you do one thing to try to like learn more about your body, just start paying attention to your cervical mucus. Because once you start paying attention, it will be so obvious to you when you are in your fertile window, when you are getting ready to ovulate. So for most women, we'll have our period. And then if you have a normal cycle length, you'll have a few dry days. So there's days where you're not producing that cervical mucus. You feel that dry kind of halting sensation when you wipe, right? Then there will be a change. And for most women, that change is the presence of cervical mucus on toilet paper. So when you wipe, you might see something wet or shiny on your toilet paper. What I encourage my clients to do is actually try to pick that up between their thumb and their index finger and stretch it. Just doing that consistently will tell you so much about your body, so much about the health of your cycle. So for most of us, we start out having like creamy, sticky, tacky mucus. So mucus that resembles glue or like lotion, right? It could be white, it could be a little yellow. If there's a little bit of leftover blood, it could even be a little bit like pink or brown. But it's often going to be creamy. You can't stretch it too much before it breaks. And then as we approach ovulation, our estrogen levels rise and our crypts produce the mucus in response to estrogen. So as our estrogen rises, right, as we approach ovulation, that mucus typically transitions to really stretchy mucus. So you can stretch it like an inch or more, super clear mucus, like you could literally see through it, and then you feel really slippery when you're wiping. So a lot of women will refer to this as like egg white cervical mucus when they're trying to conceive, right? And what a lot of women are missing is that all of that mucus can keep sperm alive. So whether you have mucus that looks like Elmer's glue or mucus that looks like a stretchy egg white, it can keep sperm alive for up to 5 days. So that's where we have that fertile window. So this is again where just paying attention to cervical mucus can also help you maximize your chances of getting pregnant because a lot of women will wait until they see that really stretchy mucus, but you might only see that for a day or two. So then you're kind of missing out on multiple days of your fertile window. It's the same reason I tell women who are trying to conceive, don't live and breathe by LH strips, right? Because a positive LH strip means that you may ovulate in the next 24 to 36 hours. Or you may have multiple LH surges before ovulation. You may have a surge and then something stops your body from ovulating. Our bodies are so wise. And if we are under stress, our bodies will likely delay ovulation because ovulation is so taxing on our bodies. So I would much rather see a woman paying attention to her cervical mucus when she's trying to get pregnant than peeing on 8,000 LH strips every day, right? So just paying attention to your cervical mucus, just looking at the toilet paper when you wipe before and after you go, trying to pick up anything you see that's wet or shiny, like that will tell you so much about your cycle and where you're at in your cycle.
Yeah, it is one of the coolest things I have to say. Like,
Yeah.
sounds kind of. I mean, to some people, like might sound like kind of gross when you talk about it, but I think it's cool. Like you think it's cool. I'm like, wow, like that is just my body telling me where I'm at.
Yeah, I don't know how you
How
can't be like blown away by that. And what I
it's
like to remind
wild.
women is like we are not born thinking our cervical mucus is gross. Like that's a result of society priming us to think our bodies are shameful and gross. So like for me, like I feel like I've just like fallen more in love with my body the more I've tracked this stuff. And like again, once you start paying attention to it, because after ovulation, for most of us, our cervical mucus dries up very dramatically. And so again, it's just like we can know where we're at in our cycle just by paying attention to one biomarker. So it really is just so empowering.
One more question on this topic is how do we know? So, if there's no presence of cervical mucus, does that mean we're not ovulating? And then also women who are breastfeeding that may not get their cycle, can they still like pay attention to cervical mucus to see if they're ovulating, even though they're not getting their period because they're breastfeeding?
Yeah, those are great questions. So what I want to start with is, first of all, a true period follows ovulation. So just because you bleed every month, even around the same time, that does not necessarily mean that you're ovulating. And I think so many of us grew up thinking that our periods were like, the big event, right? The really important event. Really, it's ovulation. If we want to know if we're healthy, then we want to know if we're ovulating. And unfortunately, there are women out there who are not ovulating and have no idea. So what I will say is because cervical mucus is produced in response to rising estrogen, and we have to have rising estrogen before ovulation. If you are not observing cervical mucus, that could mean that you're not ovulating, or it could mean that you are not checking consistently enough. So I encourage women to check literally every time they use the bathroom, before and after they go. So you're going to wipe, do your business, clean yourself off, and then wipe again. You have to be that consistent because you might see it all day and you might not. There are also some reasons why you wouldn't produce a lot of cervical mucus. There are certain medications that can impact it, especially allergy medications. It can kind of dry things up. If you recently came off of hormonal birth control, which by the way shrinks your ovaries, it can take a long time for your cervical mucus to get back to its normal production, like literally 6 months up to a year, right? So give yourself some time. And then if you are postpartum, that can also impact how much cervical mucus you see. So, postpartum is a wild, wild time because there is just no normal if you are breastfeeding, whether you are fully breastfeeding, partially breastfeeding. So, what I encourage my clients to do is start tracking that cervical mucus again whenever your lochia ends or your post-birth bleeding ends, or 6 weeks postpartum, whatever one comes first, because you truly do not know when your cycle is going to return. And unfortunately, a lot of women believe that breastfeeding is birth control, which is not always the case, right? There are very specific parameters in like lactational amenorrhea. Um, and most of us are not following those parameters for like really exclusive or ecological breastfeeding. So there is truly no way to know when you're going to ovulate, and you are going to ovulate before your first true postpartum period. Because as I mentioned, a true period follows ovulation. This means that you can get pregnant before your first true postpartum period. So what I see a lot of women do is they're waiting for that bleed and they're going unprotected, thinking they're fine, and then they end up with Irish twins. Really. I mean, it happens so often. Or they think, I'm breastfeeding, so I can't get pregnant. I will tell you, I was breastfeeding around the clock. I was following the parameters of lactational amenorrhea, and I ovulated at 2.5 months postpartum, and I got my period at 3 months postpartum on the dot. Bioindividuality will always, always win. But you can absolutely use a fertility awareness method postpartum. It's just going to be on you to be very consistent. And I'm not just saying this because I am a certified instructor. There are a lot of them out there. I can give you some resources to find some. But at the end of the day, working with an instructor postpartum is invaluable. I had that opportunity and it was so helpful because even though I did get my period at 3 months postpartum, and I got it like clockwork after that. Like things were very regular for me. But my cervical mucus pattern was so different. I was producing so much mucus while I was breastfeeding, which isn't always the case. Sometimes breastfeeding, because it can suppress estrogen production, it can actually have the opposite effect where you don't have a lot of cervical mucus. I did not have that effect at all. It can also suppress ovulation. So you might not ovulate until you completely wean. Like, and it could be years, right? So again, this is where working with a certified instructor can be really, really helpful because they can help you kind of navigate this. But you can absolutely use fertility awareness methods, and a lot of them have specific protocols for postpartum.
I love it. So, a little bit about you've talked about like a normal cycle. What is a normal cycle versus what an abnormal cycle looks like? Because I know that there's a range.
Mhm. So I like to talk about optimal cycles first. So I consider an optimal cycle a cycle that is like 25 to 35, maybe 36 days long. If you are having a ton of variability though, like so it goes from 25 days to 40 days, back down to 30 days, then up to 45, all of that variability, if it's really swinging high and low, that would be a red flag. So we should have some consistency, even though we don't always ovulate on the same day. So somewhere in that 25 to 35 day range. To me, an optimal period is 4 to 5 days in length. It should start out with heavy or moderate bleeding, and it should taper to light or very light bleeding. I like to see at least 4 to 6 days of cervical mucus, with at least one day being that really stretchy kind of clear type. We differentiate that as peak mucus, which is typically the mucus that we see as we approach ovulation. If you're not seeing any of that type of mucus, that tells me that your estrogen might not be rising as much as it should right before ovulation. An optimal cycle comes with no PMS symptoms, no painful cramps, no migraines, no mood swings, right? You'll only know you're getting your period because you track your fertile signs and you know how long your luteal phase or the second half of your cycle is, right? And people always think I'm crazy when I say that an optimal, normal, really, period comes with no pain, but it's true. And we've just kind of been sold the story that painful periods are normal when they're not. They're not normal. No one should be suffering. No one should be missing work. No one should be taking Advil every month, right? So those would all be like optimal cycle parameters. If your cycle is like 23 to 25 days long, that might be normal for you. If your period is 3 days or less, that might be normal for you. If your period is really only like a day, day and a half, maybe two, that's something where I would encourage you to check in on your iron and your ferritin. Low iron can actually and low ferritin can cause shorter periods, can also be caused by them. On the flip side, it can also be caused by longer, heavier periods, right? We only, like I said, want a day or two of heavy bleeding, and then it should kind of start to taper. You should not be changing your tampon every hour or two or bleeding through your pads every hour or two, right? So we've also kind of normalized this heavy bleeding. But that's kind of what I consider to be like an optimal cycle. If it's more like 37 days, that might be again normal for you. And then I also wonder, like, are there steps we can take to optimize it, right? To more get it into that like 25 to 35 day range. But if you are bleeding for like 7 to 10 days every cycle, that is not normal. And I see that happen so much.
I, besides your content, when I was trying last time, I was listening to the Fifth Vital Sign
Oh, so good.
podcast,
Yeah, it's so good.
and how she talks a lot about things that you talk about with like our period being so indicative of our overall health.
Mhm.
Would you agree with that?
Well, 100%. And fun fact, Lisa Hendrickson Jack, who wrote The Fifth Vital Sign, which is such a good book, she graduated from the same program I did, which is so cool. But yes, 100%. It is our free monthly report card of our health. And like so many of us don't even take advantage of that because we just shut it down with the pill. But it can tell us so much about our health. Like one example is the length of your luteal phase. So the first half of our cycle is our follicular phase. So that's our period, all the days leading up to including ovulation. After ovulation, we enter our luteal phase. And our luteal phase is the day after ovulation through the day before we get our next period. Our luteal phase should be consistent. So our follicular phase can vary because again, we don't always ovulate on the same day. But our follicular or luteal phase should be consistent and it should be in an optimal cycle 12 to 14 days long. And it should be nice and consistent, nice and predictable. Again, knowing the luteal phase length can help you know when your period is coming. Like my period is never a surprise. I think about the women who like are out and about and they have to rush off and go to a CVS and find a tampon because they get their period out of nowhere. And I'm like, guys, you don't have to live like this. Like you can know when your period is coming. But either way, your luteal phase should be 12 to 14 days long. If it is not 12 to 14 days long, that is a red flag. If it is less than 10 days long, that is a huge red flag. And that tells me that your body is not producing enough progesterone. Like literally just tracking your cycle like that can tell you what's going on with your hormones. And not producing enough progesterone is a huge cause of miscarriage, of having a hard time getting pregnant, having a hard time staying pregnant. And it's like we're over here scratching our heads, like wondering why fertility rates are declining, why so many couples are struggling to get pregnant. And it's like, well, why is no one talking about this? Again, these foundational pieces, the health of your cycle. And what I see happen so much is women will stay on the pill or stay on the IUD until they're ready to try. And then nobody's telling them that, hey, it might take your body a while to ovulate again. And then so often they're starting fertility treatments because they can't get pregnant within, 6 months or 8 months, depending on their age. And it's like, well, actually, did your body just need more time after the pill? Because those synthetic hormones, they're not just like out of your body immediately. They stick around in our liver, they stick around in our fat cells. And those synthetic metabolites from these synthetic hormones can impact the health of your cycle, can impact your ovulation, can impact the length of your luteal phase, these really foundational things for getting and staying pregnant. And it's like, I don't know, it's just so backwards. We're just like missing the really foundational pieces here.
Yeah, it's just you're told at a certain point, like, okay, try for 6 months to a year. And then if you're not pregnant by then, we'll start doing some testing.
Yeah.
But like you said, there's so many things like, are they are they even having timing sex correctly?
Hmm.
Right? Like, are they doing it just random throughout the month and like
Hmm.
throwing spaghetti at a wall?
Absolutely.
Or are they optimizing that fertile window?
Mhm.
What do you wish every woman learned about her cycle?
Oh, I guess I just wish that every woman could respect her cycle for the fifth vital sign that it is. Could get excited about their period and their cervical mucus instead of dreading it. And I know that a lot of women dread it because it sucks, right? And it's painful and it's heavy. But I just want women to know that they don't have to be dealing with that because that is not normal at the end of the day. It is simply not normal. We should not be in pain. We should not be dealing with this every single month. Um, and then I would just like women to know more about their cervical mucus because I'm telling you that one biomarker can just tell you so much about your body and help you just feel so connected to your body and your femininity.
Absolutely. How does FAM support women in different life stages? So we talked about trying to conceive,
Mhm.
postpartum breastfeeding. What about perimenopause?
So it can help you track your transition into perimenopause because perimenopause, it is a beast, I will tell you. And this is something where I believe I was transitioning, kind of in about a year ago. And my first sign was super irregular cycles out of nowhere. So I could see with my charts, that my ovulation was getting really, really delayed. And again, ovulation can be delayed for a lot of reasons, but I wasn't stressed. I wasn't sick. I don't drink alcohol really. So I knew it wasn't any of those things. And all of a sudden, my cycles went from like 29 to 30 days pretty consistently up to 40, 47 days. Like it was bananas. And then I also started feeling these crazy symptoms like really itchy legs. My restless legs got really bad. My body odor changed. Like there were so many signs. So perimenopause is this massive, massive transition for our bodies as we prepare for menopause. And I think we're at a really cool time where women are like talking about it and owning it. And charting your cycle with a fertility awareness method can be so helpful because at the end of the day, there is not a definitive test for perimenopause. We know that perimenopause can last 10 years, 15 years before menopause, and most of us go through menopause around 50. And so it's diagnosed through symptoms. And again, one of the first symptoms is often changes in your cycle. And if you're charting your cycle, you're paying attention to all of this stuff. You can know that you're entering this massive transition. And you can start to know when your cycle is outside of optimal parameters. So I think there's, again, a lot of power to like learning this method because you could use it from your first period to your last. Just one method.
Yeah, it's pretty powerful. Can tracking your cycle help identify hormonal or reproductive health issues?
Absolutely. And it can tell you before maybe you even feel symptoms. Again, if you are dealing with, I have a friend who's going through this, just every month she's having more and more delayed ovulation and she's tracking her fertile signs so she knows that she's ovulating later, which means she knows she's going to get her period later and she can use this data to go to her provider and say, "Hey, I'd like to figure out what's going on because I'm experiencing longer cycles. I'm experiencing delayed ovulation. I'm experiencing irregular cycles." I mentioned too that luteal phase defect, if your luteal phase is 10 days or less, immediately I would recommend getting your progesterone tested. Immediately, I would recommend testing your thyroid. The other really cool thing is if you take your basal body temperature orally or vaginally, so that's that resting metabolic temperature you take first thing in the morning. If your temperature is super low, so it's going to be a little lower in the first half of your cycle and then it'll be higher in the second. But if it's super low, that is a sign that your thyroid is suboptimal. And there are so many women walking around with undiagnosed thyroid disorders because Our range of normal is far too wide with thyroid disease, and a lot of doctors only check your TSH instead of looking at your full thyroid. So there's a lot of women walking around with undiagnosed thyroid disorders, and just by tracking your basal body temperature, you can kind of get a clue into your thyroid health. Like it is just, it's so crazy. And then ultimately, tracking is one of, really the only ways outside of an ultrasound to know that you're ovulating. And again, ovulation is very important. It is very important for the health of our cycle, for our overall health, for our reproductive health. So if you're not charting these fertile signs and you're just getting a bleed every, month or every, 40 days, you don't know for sure that you're ovulating. And if you're not ovulating, we really need to figure out why.
What are your top tips to couples who are trying to conceive, other than just try for 6 months to a year, come back if you can't? Like, what are your top tips outside of just having sex all the time?
We're definitely checking for that cervical mucus. Again, I think a lot of couples are relying on, a free app. So Clue or Flow or Starlight. I mean, there's so many out there, and these apps are like telling them, when to when to try. But these apps are not an effective way to know when you're in your fertile window. Checking your cervical mucus is. So as soon as you observe cervical mucus, you can start trying. Because again, all types of cervical mucus can keep sperm alive, can filter out the weak sperm, can keep sperm well fed and nourished. My next tip would be to get the man on a men's prenatal. So we put so much of the onus on women and so much of the pressure on women when sperm is literally 50% of the equation. And right now, only 1 in 4 men has optimal sperm. And we know that sperm with DNA damage, which is very, very common in men today, that doubles your risk of miscarriage. We also know that when men take a prenatal, and it's not the same as a women's prenatal, whenever I talk about this, they're like, should they just take what I take? No, we want a prenatal with targeted vitamins and antioxidants to improve sperm quality and quantity. We know that when men take a prenatal, and I'm talking at least 3 months, ideally 6, but sperm go through a 3-month maturation process. So what your partner does 3 months before you try is really important. And it's important for getting pregnant, staying pregnant, and the health of your pregnancy. We know that DNA damage in sperm is also linked to a higher risk of preeclampsia and other complications. So like sperm is so important. No one is talking about this, and we're just putting so much the pressure on women. But anyways, we know that men who take a prenatal with targeted antioxidants and vitamins have a 4 times greater chance of getting their partner pregnant and their partner achieving a live birth. So that is a really easy thing for your partner to do is just start a men's prenatal. We also, of course, want to work on their diet just as much as ours. I think a lot of women will think about what they're eating and stop drinking and stuff before they try to conceive, but it's just as important for men. And then my third big tip would be get off that birth control sooner than you think. Again, you might stop the pill and ovulate right away. You might. You might ovulate the next month. It also might take 6 months. It also could take a year for your body to ovulate again. We want those synthetic metabolites from the hormonal birth control to have time to get out of your body. We want your body to get back to its baseline, and we want to make sure that you are ovulating regularly. So I recommend at least 6 months without hormonal birth control before you try, ideally a year, because you just don't know how long it's going to take your body to get back to its baseline. So get off the pill, start a prenatal sooner than you think. Again, I'd love women to be on a prenatal for at least 6 months before they try. Longer if you're on that hormonal birth control, though, because that's going to deplete your nutrients. And then the last thing would be start tracking that luteal phase, because if it is short, if it is 10 days or less, especially, you are going to have a harder time getting pregnant and staying pregnant. And low progesterone is just so hugely connected to miscarriage. And women supplementing with progesterone, it is such an easy way to support like staying pregnant, having a healthy pregnancy. And I'm just not sure why it's missed so much and why we're not just testing women um, to see what their progesterone is at. So those would be some of my tips.
What if they struggle to conceive after a year, even after following your advice and your tips, and they're doing everything correctly as far as tracking cervical mucus, taking a prenatal, eating healthy, not drinking, all of those things, and they still don't have a baby after a year.
I would want, well, in my ideal world, we would do this before, but I would want the woman to have her thyroid checked, full thyroid panel again. And I would want a semen analysis. And I would want the couples to know, so in my ideal world, we would do this stuff before a couple tries because in my ideal world, we take a proactive approach to fertility instead of a reactive approach. Um, but sperm, as I said, are not doing so well, and doctors know that, researchers know that. But instead of taking steps to like improve sperm health, which by the by, sperm health is also really impacted by endocrine disrupting chemicals. So we need to get your men on safer personal care products, not drinking out of hot plastic, things like that, right? But semen analyses, you will often get them back and everything will be normal. But I will remind couples often that normal and optimal are two very different things. And the range of normal has been widened dramatically over the last decade because researchers are seeing that sperm quality is declining very rapidly. And so they're just widening the range of normal. So normal is not optimal. And there is definitely a reason why you can't get pregnant. I do not believe in it. Unexplained infertility. A lot of my colleagues do not believe in unexplained infertility. To me, unexplained infertility just means that your doctor hasn't done everything that they need to do to figure out why you're not getting and staying pregnant. So that's definitely a big one. And I would also recommend specifying when you do a semen analysis that you also want to test for DNA damage because that is not standard with a semen analysis. And there are only two labs, I believe, in the country that do it. So a lot of doctors won't offer it because then they have to send it to a different lab. But again, DNA damage doubles your risk of miscarriage, and can make it harder to get pregnant. So I would definitely advocate for that. And I'm sorry that you have to advocate so hard for yourself in this journey, but you do.
You've also mentioned using FAM to not get pregnant. So, what are your top tips for couples who are trying to avoid pregnancy using FAM?
Learning from an instructor. And again, this is coming from someone who's self-taught. So there's a wonderful book called Taking Charge of Your Fertility. You can use that to learn a method. You can also use the fifth vital sign to learn a method, self-teach a method. And then there's Sympto Pro, which you can get a manual and teach yourself at home. But ultimately, to me, this is best learned from other women. And so I self-taught with taking charge of your fertility, and then I had the opportunity to learn from an instructor, and it was night and day in terms of my confidence, my trust in the method. I knew I was using the method correctly, and that's when we started relying on it for birth control. So learning from an instructor is amazing. There are so many great ones out there. There is an app called Read Your Body. It's my favorite app. It's the only one I recommend because there are no algorithms and it's completely customizable. They have an instructor database, so you can find an instructor that meets your, budget criteria, that teaches the method that you want to teach, right? So I would recommend starting there. And if that's out of your budget, then, you know, get the fifth vital sign, get taking charge of your fertility, and you can learn at home, but just be cautious with that. And then my other tips would be get your partner involved. My absolute favorite thing is when a client comes to me and we take our first two sessions to actually like teach the method. And I love when their partner comes. It makes me so happy when their partner comes because ultimately men are the constant factor in getting pregnant. It's not us. So they need to take some ownership too. And I think it's important for men to know where we're at in our cycle. It's important for men to know when we're fertile, when we're not. Like I would always clue my husband in. He knew when I was in my fertile window, you know, when we had to use barrier methods or abstain, right? Like it shouldn't be this secret that only we hold. So that would be another tip is get your partner involved and then be consistent. So I think what happens sometimes with FAM is we get kind of complacent. You've used it for, years and you're really confident and you're like, okay, like I know when my fertile window opens. And then boom, you ovulate earlier than usual, right? So we can't become complacent. This is something where it truly is a little bit of time every single day. It's checking for your cervical mucus every single day. It's taking your basal body temperature every single day. So there does have to be consistency there. Um, and if that's not sounding feasible for you, then, maybe hormonal birth control is what you stay with. But if you get to a point that you're willing to take 2 minutes a day, to use on a method, then wonderful. Just stay consistent with it.
Yeah, I obviously learned from you because I was trying to get pregnant with our second, but just I'm just so grateful that I learned. I think learning from somebody just to be able to like ask questions. Obviously, I like listened to the fifth vital sign, like the whole
Mhm.
book and her podcast and everything, but it's just so empowering, like to know about my body and about my cycle and knowing what throws it off, right? Knowing
Mhm.
how stress throws it off, or if I've had a couple drinks, the
Yeah.
night before or whatnot. What role do you see FAM playing in the future of women's health and reproductive education?
So I see two things happening. I see more and more femtech. The femtech industry is booming because I think there is this push for more natural methods. I think we're kind of having this almost revolution because of social media, to be honest, which sounds so silly. But like, so many of us would go to our OBs and just be dismissed or be told it's all in our head. It wasn't our IUD, it wasn't our pill, whatever, that was causing all of these symptoms. And so women are starting to share their stories, and it's really validating. So when someone on the internet tells you, "Hey, I believe you. I believe that you're dealing with these crazy, debilitating mood swings because of the pill," it can be really, really empowering and really, really validating. So what's happening though is I think we're just at this time where women are like, "Okay, maybe I don't want to be on the pill, or maybe I want to take a break from my IUD." Um, but then, like I said, they're not actually like learning a fertility awareness method, and then they're ending up pregnant. And then everybody's like, FAM doesn't work. And it's like, well, no, FAM does work. But you just have to actually like learn a method. And so what I see a lot of companies doing is they're kind of taking advantage of this like revolution, right? And finding all of these technology ways to make it easier, right? Like so femtech is booming, and it's because these apps work off of the idea that learning about your body is too hard. So you need an app to do it, or you need natural cycles to do it, or you need KEG, which is this little device that you insert to like into your vaginal canal, and it like tells you about your cervical mucus. And it's like, well, do you need that? Or like, can you just like look at toilet paper and like try to pick up you know what I mean? So femtech is booming. And so I think we'll see that continue because it's like $1 billion industry and it's not going anywhere, which I see good and bad to that. And then the other piece is, like I said, there is a small kind of like grassroots push to educate future OBs and to educate like ACOG um, about fertility awareness methods. And so I'm hoping that in the next, couple of decades, more OBs know about it, and more OBs can talk to women about all of their options for preventing unwanted pregnancy and not just birth control. So those are that's my hope. I really have my fingers are crossed really hard. But I can tell you, like for me, I have a daughter, and it just like gives me chills just thinking about the future because I'm going to teach her all of this, and she's going to grow up knowing why she has cervical mucus some days, why she has white stuff in her underwear. She's going to grow up knowing how important ovulation is, and it's not just about her period. And it just makes me so excited. So yeah, I think, we can make such a shift in this next generation, and it starts with us learning about our own bodies.
Absolutely. I was thinking that too about I have a daughter also, and I was thinking learning this stuff, like I'm so grateful that I know this stuff now and I'm approaching my 40s and I just found out about it in my
Yeah.
late
Yeah.
30s. But now I'm like I can use it for the rest of my, for the rest of my journey and share it with my daughter when she starts hers, right?
Yeah.
Because I didn't know any of this stuff and it's very empowering, I think, to use your period as your vital sign. It's
Mhm.
it's it's incredible.
100%.
Well, I so appreciate this conversation. I've loved our time together. How can my listeners learn more or connect with you for more education or resources?
So definitely come find me on Instagram. I'm not sharing my cervical mucus right now because I'm pregnant, but I have a highlight. I have a highlight saved if you want to see my cervical mucus because again, I'm just working to normalize it and take out the stigma and the shame. But I'm at Clean Living with Carly on Instagram, and then my website has kind of all of my offerings. So I offer like one-off consults for women who are dealing with like hormone issues, the painful periods, being dismissed by their OBs. I just had a consult with a woman today who has not had a period in years, and is literally not ovulating, and no one in her life is concerned about it. And I was just like blown away by that. So, anyways, I offer one-off consults, and then I also have a 6-week program for couples who are trying to conceive. And then I have an individual program where I teach women or ideally couples the Justice method of fertility awareness, and then they can use that to get pregnant. They can use that as birth control. So I teach you the method, and then we have a whole bunch of follow-up calls.
Amazing, amazing. I will put all that info in the show notes, you guys, so that you can follow Carly, check out all of her resources on her website. Thank you so much for coming on the show today.
Thank you for having me. This was great.
All right, thank you guys for listening. We'll see you next time.